Okay, I think let's go ahead and get started. Good morning. I'm Amy Dessenberg Wines. I help support the Iowa Coalition for Integration and Employment. I'm so delighted everybody's here and joining us today. I think we have some really good information to share with each other. So our agenda for the day is we're going to have an update from the Iowa Department of Education, uh, update on the NEON project that is being launched in Iowa. Brooke is going to help us navigate some policy shenanigans. Um, we will have an update from Aging and Disability Services, our handy Iowa Medicaid update, an Iowa Department for the Blind update, and any other partner updates that folks participating have and want to share as well. We're going to try to do our meeting today just from 10 to noon. So we're going to try to wrap up by noon, and we are recording and we can share the link out with folks after the meeting. I wanted to kick the meeting off with, if I can do that, there we go. I just really wanted to thank, we had a couple of folks who have just recently retired or are in the process of recently retiring, who've been part of the coalition's work really since the start of the coalition. And that's Tammy Amsbach, who works with the University of Iowa, University Center in Excellence in Developmental Disability. Tammy's been a core team member, employment first team member, ICIE member since the start. And she is going to be retiring, I think, in early March. I don't know if you're on, Tammy, but I want to thank you for everything you've contributed to the field and all the support that you've given to ICIE and the systems change work over the years. Tammy's one of those leaders who really started to roll out employment first before it was a common term used across the country. So I also want to thank Sherry Clark, who just recently retired from NISHNA. Sherry was the executive director at NISHNA for the last 40 years, or been with NISHNA for the last 40 years. And she was also a member of ICIE since the beginning. And Sherry has been a wonderful partner in participating in pilot projects and providing feedback and being really honest and candid about reality from a provider's perspective. And Sherry was just a really excellent partner in this work. So I wish them both the best and want to thank them. Want to thank them so much for all of their contributions to the field. All right, if you're just joining us, if you don't mind putting your name and any information you might want to share about yourself in the chat, that would be, oh, there's Tammy. Sorry, I had my screen on. Tammy, thank you for everything. Wish you the very best in retirement. All right, so to kick us off, we're going to do a Department of Ed update, but if you don't mind, Kelsey, I'm just going to take a quick minute to share something I just came across. I have a lot of resources that I get referenced in my email about systems change, about change makers, about how to be part of efforts to make things better. And it's kind of a crazy time right now. It doesn't matter where anyone falls on their views, it's a crazy time. And I got a message this morning from Australia and the change that
you bring me the address for Emma Campbell.
Yeah. It was really highlighting the work that's happening in Australia around supporting change and supporting change makers. And there were a couple of things that caught my attention that I wanted to share with everybody that I think is really important for our times, not only maybe related to what we want to see for individuals with disabilities, but how we want to be as community members in any way. That might really drive us personally. So to be a change maker, some of the things they referenced were building models and practice for true collaboration and the importance of that. Helping people collaborate in ways that changes power and transforms systems. We all know there can be an imbalance in power and decision making. And I think what we've learned over the years is the more balance that is, the more equity in people's voices, the more effective and possible big scale change can occur. Learning that reflects on ourselves, our organizations, our communities, our broader systems, and how they relate to each other and to social change. Systems learning involves how to listen and hear from the whole system and consider what that really means for what the work is that you want to see happen. Collective leadership. How do we harness our collective power and our agency? Experiential learning, creating brave spaces for learning where people are comfortable and can share and feel safe. It's really important that people have a voice and can take chances and grow and develop. Growing the field of collaborative systems change. Years ago, I showed a video on how to start a movement, and it's a very fun video, but it starts really with just, I would say probably a hippie dancing at a festival, kind of crazy, and pretty soon another person jumps up and starts dancing with them, and then another, and it says it just takes one to inspire another to get moving. So in whatever realm drives your heart, you want to make a difference, you want to make a change. Those are some nice, simple rules to keep in mind. So thank you. All right, I am going to turn this over to you, Kels, to give us an update from the Iowa Department of Education.
Well, thank you, Amy, for that quite lovely introduction and lead in, because that just nicely touches on some of the updates that I wanted to provide today in terms of being involved, being engaged, and staying connected to support the systems that we work in. As such, the first couple of updates I have for you all today are just around some outreach and learning opportunities that are happening with the Department of Education currently at this time. The first one is a new IDEA Insights newsletter that we have launched. The first one went out, was at the end of last month or the beginning of this month. I tell you what, it's all kind of running together. But it will, there will be a newsletter going out every 6 to 8 weeks, so bi-monthly-ish, to help support keeping the field updated in happenings in special education. So whether that's policy updates or, new case decisions that inform our practices, or opportunities for training and learning, and just little tips and tricks for how you do your day-to-day work. That newsletter is definitely an opportunity that I would encourage you to get connected with. And Amy, I did just share these slides with you. So if you want to drop those in the link drop those in the chat for folks so they have access to the links, or they'll be emailed out afterwards. Whatever works best is totally fine. Additionally, around work-based learning, we have the Iowa Work-Based Learning Coordinators Conference coming up here in April. All of the details, I believe it's like the week of April 14th. It's a one-day conference in Altoona at the Prairie Meadows Conference Center. And it's just a really great opportunity to connect with individuals from across the state that are engaging in work-based learning in different ways for students with and without disabilities. So if you in any way connect or touch a student who's participating in work-based learning, I would highly recommend considering that conference. It's a great opportunity, and we do hold that every year. Additionally, we've launched work-based learning webinars, and those are being held each month. And those are, again, another great opportunity to connect in with work-based learning opportunities and best practices around the state. if you haven't picked up on a little theme here, work-based learning is a big priority of the departments this year and in future years moving forward, which I'm really excited about because we know how important those experiential opportunities are for particularly our population's growth and development as they prepare to enter the world of adulthood. So in particular, I did want to highlight that next month on March 4th, IVRS will be highlighted and they will be facilitating the webinar around pre-ed's work-based learning, and that's on March 4th from 3:30 to 4:30. So again, link in the slide deck to learn more and register, and you'll be able to see the archive of past topics and future topics yet to come. The last big outreach and learning opportunity I wanted to highlight with you all today is our special education division's policy and practice webinars. Now, these are webinars that are really focused around concepts in special education broadly. So they may or may not always have like a direct connection to transition, but they do impact transition in one way, shape, or form or another. You know, whether that's the least restrictive environment, FAPE considerations. We know that when a student is receiving services through an IEP, that those are factors that we have to consider and do contribute to the plan for transition that is developed for that student. So again, additional really great learning opportunities that I would encourage you to check out and consider joining it for. Are there any questions on these so far? And I don't have my eye on the chat, Amy. I don't know if you have, or if you're able to help me monitor that.
Yeah, absolutely.
Thank you.
I don't see any questions right now. Folks can unmute or please put something in the chat if you have any questions. Thank you.
Perfect. Thank you. Thank you. A couple additional notes. Super exciting update on the ICIE Family Portal. I know Shannon was here a couple months ago and shared a lot of really great information about the ICIE Family Portal with us, but it is finally going live next week, and we are so excited. Parents or students whose rights have transferred will receive emails, automated emails to be able to sign up. So the most important thing for those students and parents to know is that it's really important that their IEP facilitator, their roster teacher, their SPED teacher, whatever they call it in their district, has their most up-to-date email on file, because that's the email address that that invitation to sign up will go to. We've also hired help desk staff to assist with any questions or support needs that parents and students have as they're trying to access the portal and get connected to the records in that way. So if folks are having issues or need some additional support with that process, Achieve Support at iowa.gov is listed here on this slide, and that would be the best way for them to reach out and get direct support in navigating the family portal. I also wanted to share, particularly because of its connection to secondary transition related efforts, that there was a legislative task force that convened last semester. There were 3 meetings that resulted in that task force generating a report of recommendations around graduation requirements and 21st century skill standards to Iowa's legislature. There will be a second report released this summer after additional meetings are held this spring. So I have linked that in there for your reference if that's something you're interested or want to learn more about. Particularly the graduation requirements, I think, is helpful to review because it really clarifies what the state's requirements are for graduation for a student to earn a diploma and what districts' flexibilities are in developing their graduation requirements for students to earn a diploma. And in addition to that, ways that IEP teams can drive or customize that plan for earning a diploma based on the needs of that student. So that would be another resource I encourage you to take a look at if those are questions or information that might be helpful in your work. Any questions on those 2 items?
Why not?
hearing about that till.
Sorry, Mari, did you have a question?
I was just wondering about when, like, when did this come out? This is the first time I'm hearing about these things.
About the review or the portal or?
The review with the graduation requirements. Yeah.
Sure. So, let's see, that report was filed with the legislature on December 31st.
Last
so-
year.
Yes, of 2024.
Okay.
So about 2 months ago, yep. And gosh, I'm trying to think. I think the information went out in a variety of different ways because it was something that was legislatively ordered. So it wasn't necessarily an initiative of the Division of Special Education or SEEP or anything like that. We did share and give updates to SEEP about it at the beginning of this semester. But I think otherwise you would need to be looking pretty closely on the department's website to find, the schedule of public meetings and then the legislative report section. And after I get done sharing here today, I can drop those links into the chat. So you have those as well, Mari.
I appreciate that. Thank you.
Yeah, no problem. Other questions?
Well, we get a lot of calls around that issue. You might
Yes.
talk about this a little bit, but so.
No, absolutely. And actually, go ahead, sorry.
Just thinking, is there anything we could help contribute to that, I guess?
Well, actually, maybe this is an opportunity to plug that next upcoming Ask an Expert webinar that you guys are addressing around 4333. Yeah,
absolutely. We have a series of transition webinars coming up through Ask Resource Center. Pam's going to be leading those, and we've got a webinar around the components of transition planning, and that includes some info sheets around 4+ services and the 4333 graduation requirements law and things like that. So yeah, it's an issue we've been working around. We get a lot of questions and concerns from families who kind of last minute find out, oh gosh, my kid's graduating. We thought we could go till 21 and I guess not. And so this has been a big issue that we've seen a lot of concerns around. So thank you.
So I was just wondering, Kelsey, if you saw the info sheet or went through that, do you see where that's going to need major changes after it goes through the legislation or not so much?
Great question. Right now, there are a couple of different bills related to graduation requirements that are being considered by the legislature. In particular, there is one around a civics test. I will say you will not find any recommendations around a civics test resulting from this task force, but that is something that has been proposed by the legislature as a requirement for graduation. So something that, might need some advocacy, or you might look at contacting your legislatures about is what that requirement looks like for students with disabilities, and particularly our students who are on the alternate assessment. What would their pathway to graduation look like if they aren't necessarily proficient in that content area based on their disability?
Okay, thank you.
Yeah, absolutely. But otherwise, the reports or the recommendations that are contained in this report, I did not myself see any major red flags or concerns for impacts on students with disabilities. In fact, I think some of the recommendations would further support the goals that we have in this coalition for our students.
Kelsey, I'm sorry, I just have one more question on this too. So, because I too am just now looking at this comprehensive review. And so it does not address students with disabilities at all in it, correct? Because even if you do a word search, you don't find disability related at all. So
it does. So actually there was a representative from the Division of Special Education on on each of the task force facilitation
Okay.
committees. We weren't members of the task force, but we assisted in the facilitation of those groups. And we were very intentional in making sure we addressed how these considerations, how these standards, how these graduation requirements impact students with IEPs. So maybe look for the word IEP instead of students with disabilities. That might help find some of those specific
Gotcha.
mentions in that
Okay.
document.
Thank you. That's helpful.
Okay.
Thank you.
Absolutely, no problem.
I just didn't want to read an 84-page report if it didn't have anything to do with the
Right.
people that we support.
Yeah, absolutely. And I would imagine for you, Brooke, you're probably interested in content areas beyond transition. So the page 9 and 11 that I referenced here is a little bit more limited than what you're looking for.
Elsa, I don't know if this is something that you can talk about from a kind of a conversations within the department or not. And this might be something that Brooke brings up in her policy shenanigan review. But it's really around the current lawsuit that's occurring that I was signed up to participate in with 17 other states against the federal government, against 504 requirements. Is that anything that you have any comments about, or is that something we should defer to Brooke? I don't know, Brooke, if you were going to talk about that.
I am more from an advocacy standpoint because yeah, it's more than they signed up for. They joined the lawsuit to sue the federal government on it. But yeah, but definitely, Kelsey, if you've got more information, please go right ahead.
I unfortunately I wish I did, but I really don't. I learned about it and know about as much as what you all see in the newspapers. So Brooke, I'm really gonna lean heavy into you on the advocacy side for that one. Thank you for that question though.
Thank you. Any other questions or comments for Kelsey?
I've got one more slide.
Oh, good, thanks.
Yes. I just also wanted to share a couple of quick updates around our continuous improvement efforts, because I know we've talked a bit about what that looks like for secondary transition and employment related services in particular. So just to give you guys an update, this is the end of our first cycle of that professional learning and designation. So those 33 districts that have been identified particularly for secondary transition are just kind of wrapping up, and we'll have new designations coming out this fall. So then we're really looking at scaling up, revising, and moving through the process again, potentially with potentially with 33 new districts, but there could also be districts that are continuing in the same designation that they had previously. So looking at how are we going to continue supporting them and further enhance the professional learning and coaching supports that they need to improve those post-secondary outcomes in the areas of living, learning, and working for their students with disabilities. Also, you might be hearing some buzzwords around AEA accreditation coming in the next couple of months. This is a big initiative that the department is focused on as a result of that House File 2612. I think that's the one you're all most familiar with as the AEA bill, the changes to the AEAs, right? So part of that, that legislation required us to go in and review, update, and implement an accreditation process for each of the AEAs that will be implemented for all 9 AEAs this spring. So we're going to be pretty busy digging into that and visiting each of the AEAs. But I wanted to let you all know that that is happening, and that I would encourage you to check out our website that I've linked here for additional updates related to that bill and changes that are coming or have been made to the AEA system. It's all available right there.
Hello. Hi.
And that is my last slide this time. So I will just open it up for questions one more time, and then I'll hand it back to Amy.
thank you so much, Kels. I really, really appreciate your time and putting stuff together. Excuse me. And
Absolutely. Thank you.
it's so helpful, I think, to get updates from partners on what's happening because it's a moving target. You know, there's so much going on right now. So thank you very, very much. And thanks for those who jump in and share things and also try to tie some of those updates to other questions or opportunities. That's really important, and it shows a great way of how we can take stuff that we hear today and take it back to our communities and use it. So, all right, thank you, Kels. Lynn, I'm going to turn it over to you, and I'm going to put the link to Lynn's presentation in the chat here in a second. And then, Lynn, if you want me to do slides, you just holler.
Okay, I'm gonna see if I can grab the slides, and I don't see the share thing yet. Just a second. Come back. Um, okay, do we have it? Can you guys see it? You can? Okay. Let me see though. Looks like I want it to be full screen. I don't know. Are you seeing it full screen, or are you seeing the little thing along the side too? Yeah.
You might have to get out of share for a second
Okay.
and start the presentation and then go back to share.
Okay. Let me try that. There we go. Okay, now, oops. I can't find you guys back. Oh, doggone it. Okay, Amy, I'm gonna try to get out of here and let you
No problem.
share
Happy
just
to
a
do it.
second. If I can find, I can't even find my screen back. Crap. I'm so sorry, people.
You're good. Can you guys see that?
We can.
Thank you.
And the important part, Lynn, is we can see and hear you.
Okay, well, I can't see anything other than a blank screen, so I'm gonna try to get out of here and show. There we go. And get back to the Zoom. Love it. Okay, here we go. Sorry about that, folks. You would think after so many times of doing this kind of stuff, I'd have it figured out, but no. Okay, so NEON, you might be hearing a little bit about it lately, stands for National Expansion of Employment Opportunities Network. And this is a program that comes from the U.S. Department of Labor, Office of Disability Employment Policy. They've had NEON efforts going on for a number of years. And this is, I believe, the state of Iowa's first time that we've applied for this. So next slide. Next slide just shows our Iowa employment vision, basically, and it's the same thing we've had since, oh, I don't know, oh, I think we skipped one. We skipped several, or did we? No, I'm sorry. Go ahead. So NEON started in 2024. It's a kind of a fast track thing. It started just in December and it concludes August 31. So we're gonna try to see what we can do in that amount of time in Iowa. So next slide. There's our vision that we've had since, I don't know, at least 2011 or so. It hasn't changed. You guys are probably quite familiar with it. Next slide. And why we focus on employment. You guys are probably familiar with this also, but because most people want to work, but a lot of people with disabilities do not have a viable option to work. It's a cost-effective alternative to day treatment, a typical role for adults, and it's an essential part of well-being and satisfaction in life. Next slide. I think I'm on the wrong PowerPoint, but we're going to go with this. It's just a little bit more detailed than what I had planned. So go ahead to the next one.
My screen seems to be delayed, and when I've hit advance a couple times, I'm afraid it's going to jump to a lot.
It might. We'll see what happens here.
Okay.
Okay, so here's our two basic goals for Neon. The first one concentrates on providers who have both a day hab program and an employment program. And what we're going to try to do is we're going to select some pilot providers and help them to create a replicable pathway for members or customers to explore community integrated employment from their day hab settings. And where we've got a slate of national subject matter experts that are going to assist our providers in learning how to do this and creating this change within their programs. And then a second prong or a second focus is we have two CWICs in Iowa who are going to, Ashley Lance and Mandy Hatton are going to make some resources that are layperson speak, very accessible to families, students, caregivers, teachers, anybody that touches the lives of our people with disabilities who are in transition. And we're going to house these resources on the Medicaid and hopefully the University of Iowa Learning Management System. We're not looking at huge, we're not going to replicate anything that VCU is doing or whatever. We may, reiterate the links to those items, but this is just a focus on creating some 1 or 2 page infographic type of things that help people understand the impact of work on benefits and help dispel some of the common myths that keep people from exploring the pathway. Next slide. So this is just more detail about our first goal. So right now, state policy leaders and funders are meeting to look at how we can better sequence and braid funding strategies to encourage community integrated employment from DAHAB. We're not looking at changing any rules or regulations at this point. We're looking at how can we better do what's possible within the current system and make that more accessible, readily available. We'll ask for providers' input once we have kind of a plan. And then talks about we'll select some pilot providers and offer them the TA that we have lined up. Our SMEs are Selena Cavaluzzi out of New York. She's done this with Goodwills across New York and New Jersey. Kara Huss from Hills and Dales. She's done it with Hills and Dales. And then many of you familiar with Sue Ann Morrow, who used to be our MFP employment specialist. Next slide. And then on our benefits planning prong, we know there's a lack of current and accurate information out there for many people, and that fear of losing benefits is the biggest barrier to people seeking employment. So these guys will create some resources specifically targeted to transitioning youth and their families and other teammates, team members, and hopefully we'll make these things readily available to whoever wants them. Next slide. And this is just a quote from my boss. Iowa has made great strides with its initiatives over the past decade, and NEON will enable us to continue the forward progress in benefits planning and community integrated employment, especially in DAHAB settings. We're grateful for this opportunity to effect these changes. Next slide. And that's just my contact information. There you go.
Questions or comments for Lynn?
I will say we just did the invitation for the pilot providers to apply. That went out on Tuesday. And we're hoping to have those back March 4th. And then we'll announce selections later, a little bit later in March, I think after about 10 days or so.
I really like the focus on basics of benefits planning. And I remember as I reminisce about my work in this area, how at one point we started off with, we wanted everybody to be able to refute the statement, I can't work because I'm on Medicaid, or I can't work because I'm on Social Security. And so we wanted just the basic knowledge that that is not true to be just general knowledge. And then maybe a couple little bitty ways that is true before you get to a huge benefits plan that takes quite a long time and is intensive. So anyway, I really appreciate the benefits work that's going to provide those little fact sheets or whatever. So
Great, thank you. And I see there's a question in the chat says, does an individual have to be funded by VR? I I think the answer to that is no, because we're dealing with both VR and Medicaid funding. So it's helpful if they are eligible for both, but I don't think that not being eligible at the start would prohibit them from being involved. And as you know, VR doesn't fund day hab. So if we're looking at first people that are already engaged in day hab who haven't explored employment or don't have employment goals in their individual program plan yet.
Any other comments, questions? Feel free to unmute if you'd like, or you can put something in the chat.
Are we able to make referrals for students coming up that might be DayHab participants? Or are you just starting with the DayHab facilities?
Yeah, we are working with the day hab facilities, not the individuals.
Okay,
Yeah,
thank you.
you're welcome.
I just want to thank Lynn and all of the folks who are implementing Neon. When Iowa's been doing, pardon me, Iowa's been doing specialized projects for a number of years. And, it always sounds like a great opportunity and we always want all the partners to jump in and do it. But the truth is it also adds a lot more work to people's plates, especially the leaders like Lynn, who are trying to make it happen in a very short period of time. And if any of you have worked with the federal government, they don't make it easy. So
We have to be fast, but they're not.
yeah, exactly. But it really has launched a whole lot of our work over the last many, many years prior to ICIE, during ICIE, and it has really enhanced and led to lots of change. So for the state partners, for the providers, for the community partners, for all the people who jump in and make this happen, it's really incredible. So thank you, everybody. All right, and Lynn put her contact information in. Excellent. Anything else? Thank you, Lynn. Thank you for the update. Brooke, let's talk policy.
Are we sure we want to bring everybody down, Amy? Well, hello, everyone. I hope everybody is doing well out there. I know these are kind of unprecedented times for us, and people are a little bit anxious about what's going to happen and whether or not they're going to be able to continue to provide the great services that you guys are providing. So just hang in there and know that you all do great and wonderful things for our Iowans with disabilities. So keep fighting the fight, I guess, to start off on a good note. I think I'm going to focus my comments around three big things, and then I might have some time to go over just a couple of the policies that we're following. So some good news. There's a new work without worry bill, so I'll talk a little bit about that. Then we can talk a little bit about the 504 lawsuit, and then maybe just a little bit of advocacy that we'd like people to do around the potential cuts to Medicaid. So starting off with some good news, Josh Turek did release, I guess you would call it a 2.0 version of his work without worry bill. It's House File 424 for those that like to follow things. And this eliminates all assets and income limits for people who are working. So it kind of under the Medicaid for employed people with disabilities, it would get rid of those assets and income limits for folks. It allows also for a 6-month grace period if someone loses their employment or has a health crisis. So that's something new. There will be a companion bill to this on the Senate side, which we didn't have last year. So there is support on the Senate side. We haven't seen that yet, at least as of this morning. So good news that way. So that support on both sides of the House, both sides of the House and Senate for this bill. There's also going to be an amendment for this that will change how the bill's premiums are originally put in there now. So be on the lookout for that. I think the process they have in there for the premium now makes it actually higher than what people would be spending now. But Representative Turk believes there will be a subcommittee meeting sometime on Tuesday, the 25th on this. And he is requesting there be a presence of people with disabilities at the Capitol to support this bill. We're not sure yet what time that subcommittee will be. We should maybe know either today or tomorrow, but sometimes those don't come out to the last minute. So we may not know until Monday what time that is, but would like to have a lot of support for that bill because that's something I think we've all been advocating for, is to eliminate those assets and income limits for people with disabilities. Any questions on that one from anyone?
Excuse me. Once you have some of that information, excuse me, if you want, we can forward it out to the coalition and ask them to share.
We definitely will, and we will also. Oh, good. Jenny had been. I think DRI had been working on that amendment that they were putting in, so she's got some information in there. So thanks, Jenny, for putting that. We're also going to send out a blast to our network asking folks to come and show a presence. So you will see that. And I should let you know it's also going to be our Bill of the Week through Infonet. Every week we put out a new Bill of the Week where we highlight a bill and give people some information specifically about that bill. And then we also have a companion to that that's talking points for advocates to use. So that should be out for sure by Monday morning, if not before. So be on the lookout for that. And just another plug in for that, you can follow this information. We had a Capitol chat last Friday, so we won't have one this Friday, but there will be one on the 28th. So get signed up for that, and I'll put those informations in the website for that. So you can keep getting that information. So let's talk a little bit about 504. So as I think Amy said, there are 17 states back in September. And so we're just now kind of hearing about this month, but back in September that filed a lawsuit against the Section 504 that just recently, during that time, put in new rules that kind of strengthened the healthcare mandates under that law. And so for those that don't know, 504 is a civil rights law that protects both adults and children from not being discriminated by all federal programs, all programs that receive federal funding. So I know a lot of people think about 504 as, the plan that their child might have in school, but it's really a lot more. It touches things at hospitals, healthcare, doctor's office, transportation, housing. If it's federal funding, they have to follow 504. So 17 states, Iowa included, sued over these new regulations of the rules that passed last year that actually offer just more protection for healthcare, like making sure doctors' offices are accessible, and that people are not denied care, which was some of the horror stories we were hearing during the pandemic, that folks were denied care because they had a disability and also had COVID. They weren't receiving the same amount of healthcare that they should have just because they had a disability. So that kind of stemmed why these new rule changes came about. And so in the preamble of this bill, there is mention of giving an example of gender dysphoria in the preamble. And so what the preamble is my understanding, is just kind of a description of what that bill means. It's not actually in rule, or it's not law. And those words are not anywhere in law, but that is what the states say that they were suing about, was that they wanted that to be taken out of. But what this does is the way that this has been filed, it could declare the whole law unconstitutional. And now there's been an awful awful lot of pushback on this, of course, because this is so detrimental to the people that we support. And what some of the messages the AG's office, including ours, are saying is that it's wrong. It won't affect 504. But that's actually not true. The way it might not have been their original intent, but the way that it comes out, if the court favored in this favor, it could make the whole law unconstitutional, not even just the rules that were just changed, which could then have an effect on ADA, the onset decision. A whole bunch of different things could come from on behalf of this because of that. So what can you do about it? Contact the AG's office. We do have an action alert currently on our website, and I will throw that in there too. If you are a little bit nervous about doing that, you can use our action alert that actually drafts the message for you to contact the Attorney General's office about it, or create your own letter and ask her to drop out of the case. I mean, we've requested the DD Council and Disability Rights Iowa have requested meetings with her, and we haven't gotten that scheduled yet. But this is a super big deal. So get your advocacy hat on and contact the Attorney General and ask her to drop out of this lawsuit. And I don't know, is there anything in the chat, or there's some questions about it? I'm sure Disability Rights Iowa might have some more information on that particular part than what I do, because I'm not a lawyer by trade at any means, or nor do I pretend to be one.
Mark, you had your hand up for a minute. Did you have anything you wanted to say or ask?
Well, I think Brooke answered it. I was just going to ask her if it was possible for the AG, Iowa AG, to pull out of the lawsuit if she wanted to. And I think the answer is yes.
Well, yes and no. I was on a call yesterday where they said that because there's a new administration, and so because of that new administration, there's been a hold placed on these particular rules. And so there's some states, I haven't heard our particular Attorney General say that, but some states have said because of that, they can't pull out until they make a final decision on the 25th, when I think they're supposed to weigh in on this. But I think we could still ask that of her. What we're hearing is that, and her press release said this too, is that it won't affect anybody's 504 plans. Well, the whole thing could affect more than just 504 plans. It could make the whole thing unconstitutional. She's disagreeing that it does that, but every other person that's reviewed it, on the other side of the AG's office, says that it does. Daniel Van Zant had a really good article in the Des Moines Register about it, and I can put that link in the chat too. And then Bleeding Heartland also did a really good article on it. Now, granted, that's a nonpartisan publication, but she asked the editor of that, or the writer of that article, asked some really tough questions, and it's a good read, even if it is a little bit one-sided, or that, not the article, but the Bleeding Heart publication itself. So I'll put all this information in the chat for you guys too, but there's a lot of information about it that we need people to advocate and have their voices heard. Somebody else's hand, I missed it. Is there any other questions in the chat about that? Cami, your question, there is an age limit on this, which was different than thank you for bringing that up, which was different than what he released last year. It does have a 65 age limit on it. So it's for folks that are employed, I believe 18 to 65. And I don't know if you remember, we haven't seen a fiscal note on this yet, but it was that adding people over the age of 65 to the MEPD program that they thought was going to be most costly. So I don't know if that was his reasoning to at least try to get something through to limit that age.
Well, I remember last year, that's why he put it back in from his original, which didn't have the age limit. But I think that is problematic. Well, it would be really, really helpful to have no age limit, because first of all, your full retirement age for Social Security now is not 65 anymore for most people that are getting there now. It's 67, 66, whatever. And also, people with disabilities who are working part-time and who've always been in a economically disadvantaged state work beyond retirement. And just the
Says
benefits
someone
planners
who's
on here.
retiring.
Yeah, as I'm retiring, but I'm not in MEPD, so this is not me. The if I am on like any kind of thing, like one of the things I've recently heard is the ACT plan service, and I lose my MEPD, I lose that service that is keeping me out of the mental institution or out of the hospital. I would lose because I'm no longer eligible for Medicaid because I might have some earnings or resources that are above the regular Medicaid rules. Does that make sense? So if somebody turns 65, they've been on MEPD, they've been working, they've been receiving whatever benefits they've gotten from Medicaid, whether it's just basic health care or if it's waiver type services, that goes away at 65. Their assets then all become counted against them, and any earnings or any like, I mean, there's not very many people that have a big 401k plan who are on MEPD, right? I mean, there might be a few, but I doubt that it's millions of dollars. And I also doubt, this is my opinion, I believe the fiscal note would be a lot because it would say anybody over age 65 could be on this. And there's so many Iowans over age 65, it's millions and millions of dollars. But I imagine if you dug down into that data and you figured out how many people are on MEPD now that are going to age to that and how many would stay on it. Anyway, it's a whole complicated thing. It's a big thing. So, and I see Leanne, nodding her head, but I get it. I get it. It's just something that um, is a gap that I don't know. It shouldn't. We don't want to diss the whole thing, but it's really
Right. I
anyway.
hear you. And they did model this, I should say, after Tennessee, this law, which
Yeah,
eliminated their asset limits. And I think Tennessee had the same thing with the 65
I
age
don't know that
limit.
for sure, but yeah,
Um,
I mean, I believe it, but that's the big deal.
yeah,
The other thing some states have done is not consider assets gained while on MEPD. Like, now I'm
yeah,
going to go on regular Medicare or Medicaid, and I have my 401k plan that I got while I was on MEPD. Some states will not count those in the resource stuff for regular Medicaid. I
yeah,
mean, it's all just, yeah.
So
yeah.
this is, oh, I was just going to say, this is Jenny Lyons. I'm with Disability Rights Iowa, and our WIPA team has been reviewing this since this is something that obviously we would see impacted on individuals every day. The big piece is there should be an amendment. Unfortunately, we are not seeing it yet. So, you know, legislative services, it's a process of getting everything up. And that's why we don't have the number for the Senate bill yet. But the big piece is, as it is currently written, it does. There are negative things that would happen without the amendment. And so it is important to make sure that this amendment that has been said it's coming through actually does show up and is the one that individuals are looking towards, because without the amendment, there were things that would disincentivize and actually likely remove a lot of people off of MEPD. While as it's written, it does remove income and resource limits. The premiums, like for example, if someone was between their benefit check and their earnings, had $3,000, their premium was going to go from $93 to $180. So that's why the premium numbers are something to be looking for in the amendment. There was also language about how to consider someone who's employed. The amendment should outline that it keeps with where MEPD currently is, because how it was written, it could imply that someone would have to have a lot more earnings, closer to like 15,000 to be able to be eligible. So the big thing is only some of it's out, is to be watching for sometime in the next week before supposedly Tuesday when there's going to be hearings, to be watching for that amendment, because that would greatly change the bill as it currently is.
Jenny, I'm retiring March 3rd, so I throwing this out there. how they calculate the fiscal note that says how much this costs is something to look at, because when Josh Turk told me last year what the fiscal note said for this over 65 thing, I just thought that's like saying every person who's 65 in the state will be on MEPD all of a sudden, and that just wasn't it wasn't the formula, or it wasn't a clear-cut picture of the actual, I don't know. I guess it would have been possible in somebody's dream. But anyway, I think looking at any fiscal note and how they're calculating it would be worth it.
Well, and one thing, this is Misty from DRI as well. The one thing to keep in mind is Tennessee did not have an MEPD buy-in. This is new to Tennessee, so there's definitely differences in the way Tennessee implements this than what Iowa should implement it as. Like Jenny mentioned, kind of took the words right out of my mouth. You got to watch for the amendments, because as it is right now, although on the surface seems super helpful and takes away those incomes and resources and that kind of a thing, it needs to be amended or it's going to hurt a lot more people than it will help.
And
So
I think
be watching.
Disability Rights Iowa, I think Catherine has had that conversation with Turk, and he's aware that we just haven't seen it yet. I think he's planning on having those amendments. At least that's what we're hearing. So, but we would like, and people can obviously go to that subcommittee and make those comments that that they support the bill with those amendments. I think that will be helpful, helpful for that. And going back to the 504 lawsuit, I did put in, I don't know if folks have been following this, but the disability rights, I can't keep forgetting what DREDF stands for that acronym, but they've been putting together a lot of materials on this, and I put the link in there. They had a good webinar about this. Gosh, was it just last Thursday? You can follow them and get some of their resources about it, and they've got some really good talking points. If you do perhaps get a hold of the Attorney General, we have still been struggling with that. Amy, how am I doing on time? Okay. Well, I do think we need to talk also about the other big elephant that's happening on the federal level, and that's with Medicaid. It's almost to the point where I think we all actually have to say that not to cut Medicaid, but it sounds like it's pretty evident that they're going to cut Medicaid. I think we just need to keep advocating about that. I don't know if folks have been following, but the House, there's a reconciliation process that's going on right now. But the first step of that is what they're calling these resolution budgets. And the House has this one big resolution package that the president has said that he supports. The House is trying to put together two resolution packages. Those two steps have to happen before they can go into a reconciliation process for the whole budget. And this, a little bit about this, just if you want to know the reconciliation process, I guess it just makes it easier to pass budgets because at least it will this time around, because the House controls or the one party controls both the House and Senate and the presidency. And so they can pass a reconciliation budget without having to have debate or what they call a filibuster. So where, the House or the party that's not in control can delay it by keep debating it so they don't pass their deadlines. So because they control this, they can do this all through what they call a reconciliation process. But on the House side, they have been instructed to cut $880 billion from spending out of the House Energy and Commerce, and that's where Medicaid lies, which is probably most of that budget. And so that's what they've been instructed to do. The Senate side is under similar instructions. It's not that same dollar amount. I want to say that's $1 billion from the Senate Health Committee. So these conversations are happening now, but you can still advocate. We've been trying to reach out to our representatives on the House side, and we met with Grassley's staffer last week on the Senate side. But do reach out to your your representatives and your senators and tell them to vote no on these resolutions. That's the first step before it gets to the floor, it gets to the reconciliation process. So tell them to don't cut Medicaid and vote no on these resolutions that cut Medicaid. And we've got some information on our website about this. And if you have any questions about how to do that, reach out to the DD Council. We can help you put together some stuff. We had a webinar about this 2 weeks ago. And at that point, it was still kind of up in the air with what they're going to do, but it really sounds like there will be cuts to Medicaid, and this could have devastating impacts on the people that we support. So we just need to keep advocating. We are collecting stories right now. People may have saw the Facebook post that we put out there, but if you have a Medicaid story about what Medicaid means to you, and you can share that with us with a picture and your zip code, we're collecting that and sending those on to our Iowa Congress folks. And then we're also putting some of them for those that give permission on Facebook as well too. Then we'll just kind of, I guess we're in a wait to see. If you did attend our webinar, some of the stuff they're talking about is, obviously requiring work requirements for people that are on Medicaid, block granting Medicaid, putting a cap on the number of people in the state that can receive Medicaid, kind of a bunch of scary stuff out there. So be paying attention to that. Some other things that we're following. I don't know if Roxanne was with us or not, but as many know, Roxanne Kogel, who's with the Epilepsy Foundation, has been for the past, 5 years, working on a bill about seizure-safe schools. And it actually, I believe, is now safe from funnel as it passed out of the Senate subcommittee. And it just has a new number now. It's Senate File 368. As if you guys recall, this requires that personnel be trained in seizure first aid at the school, that there's at least one person that's trained on administering seizure medication. It could be a nurse, but there needs to be at least one person trained. And then it also helps families develop alongside with their school a health plan if requested by the family. And this has a companion bill, which I think is still in subcommittee, which is House File 102. But so that's moving. So that's good news, because I know Roxanne's been working on that for a while. The other bill that we've been following for a couple of years is the comprehensive secondary transition scholarships for programs like the REACH program in Iowa City, the NEXT program in Northwest College, and then Mason City has one too, but NIAC, I can't remember what their program's called, but they this is actually safe from funnel as well, which is March 7th. There's two bills, a House and a Senate bill that authorizes or appropriates $5,000 per student. I believe it's up to $100,000 for this. And as I said, one is actually on the Senate floor, and that's Senate File 282. And it has a House version too, that's been supported by Chad Ingalls, who's a Republican who had two children that actually went through the program. So that one actually might have more of a chance this year of passing. And so we're excited about that. And then there is an autism bill out there, House Study Bill 122, that moves the applied to behavioral analyst services that are out of the autism support program into Hawkeye coverage, which is the children's coverage. So it makes it a permanent coverage benefit under that instead of a separate program. And so that's out of subcommittee too. Again, you guys can follow all of this stuff on Capital Chat or in our website to keep up to date. And hopefully you guys are all signed up to our network, because we send out weekly emails that has all this information. So you don't have to listen to me. Oh, good, Roxanne. Did I say that bill wrong, Roxanne? The bill number wrong?
No, I think you're fine. I didn't quite hear it, but it did get just renumbered yesterday.
Yep. So good work on that, Roxanne. I think
Yay, Roxanne.
There's still a ways to go, but thank you.
Well, but did you guys get it to the floor last year?
No, not in the Senate. It's passed through the House multiple times.
Yeah.
So
I'm hopeful. I have to be hopeful about some things, please. I think that's, unless anybody has any questions, and I'll put some of these things that I've been mentioning in the chat for folks.
Thanks so much, Brooke. That's a really awesome update. I know I really appreciate it. I know I try to look through all the information on the emails, but I know it helps me just to have you cover it.
I don't know how well of a job I do, but that's what you get.
Any questions or comments for Brooke or anybody else? I appreciate Mark sharing some suggestions for how easy it is to reach out to folks. And I can just tell you from my own perspective, I still feel a little nervous sometimes. Like, am I going to say the right thing? But you know, it doesn't really matter if you say it exactly perfect. You just have to try to say it. So thank you. Thank you, Brooke. Anything else? All right. Kyra, can I lob it to you to do an update for
Yeah,
aging and disability? Thank you.
that's perfect. Here, give me just 1 second. I live in the land of tabs, which I'm sure a lot of people can relate to. So today I just want to give a little update on our aging and disability services system alignment. I'm sure a lot of people have been following it, or if you haven't, I just want to kind of start at the beginning for those that maybe have been or haven't been hearing about the changes. And so, so the disability services system is kind of in the process of being, I call it being teased apart from behavioral health. We kind of started this process about almost a year. It feels like almost a year ago. And so I'm going to drop into the chat our, I know Brooke's dropping some links too, but I'm going to drop into the chat the Iowa HHS system alignment page, which has a lot of the information just about the system alignment in general. It has resources and information on the background of where we started in 2024 with the House file. 2673, which really starts pulling apart behavioral health from disability services and starts to make them their own standalone systems. And so the disability services system will come apart and start to serve anyone with a disability. And I know that some individuals don't identify as having a disability. And so that's something that we'll start to work through as well. But our system will serve individuals 200% of the federal poverty level or below. And we'll focus on serving individuals with brain injuries, developmental disabilities, intellectual disabilities, and serious mental illnesses, and also focus on the pieces of like supporting community integration. So serving individuals in the least restrictive environments that we can really focus on that community integration piece. So serving people where they want to be. And so today I want to cover kind of a where we are currently piece. And so on that HHS system alignment page, at the very bottom of that page, I'm going to share my screen really quick. Let me find, there we go. At the very bottom of this page, there's always this implementation resources. And that we give a quarterly update every quarter on where we are, and it'll tell you where our milestones are at. And so I just wanted to highlight where we really are with these quarterly milestones. So I pulled up and scrolled to the disability services section of that report. And this is always available. So you can see where the behavioral health system report is and where we are with disability services. So I'll go back really to this tab 1 second. So you can see this is the March 24 report, and it has the, so you can see where we are. So I'm going to go to this report. And I scrolled down to see where we are and see what our current milestones are. So right now, we're in the process of developing contracts for the disability access points. We're developing those performance measures that go with that contract. We're really like working on the funding methodology that goes with that and how we tease apart how all the service lines will work with that system. And we're really addressing the administrative rules. So we had those informational sessions recently. And so also we've published those in the administrative rules bulletin. And so I'll show you where you can access all of that information. And then we've also been developing standards for how the disability access points will start to implement their work. And so that's really where we are right now until we can announce who the awardees are from our RFP. So that's kind of where we are. I'm going to now show you where you can access our disability services system information on the HHS website. And you can actually navigate to it from the alignment site that I provided. If you go to the top here, I know I just scrolled, but they have the HHS websites can be really hard to navigate. And I just want to acknowledge the elephant in the room that I know that they are really hard sometimes to navigate. But so we've been putting these little tabs here at the top to help kind of folks navigate. So if you click on one of these, it would take you to where I was just at, the resources, and it will scroll you all the way to the bottom. But here they have related topics. So if you wanted to know the behavioral health service system, and then you could click on here to the disability service system. So on my computer, I just have this one saved as a favorite, the HHS one, and I know I can navigate where I need to from there. So that would be my recommendation if you're looking for a hot tip on how to navigate. I do it a lot. So then I would click the Iowa Disability Services System. And this will take you, again, if you were looking to go to a certain portion of our website, you could just click here and it will scroll you down to whatever section you want to view. I do want to point out that we're putting up a bi-weekly FAQ. So if you do have a question that you would like to ask, you can just click here and it will take you directly to a big FAQ that we're putting up every week or bi-weekly. And you can, it'll bring you to a form you can fill out and say like, this is my question. And it'll just take you to a really simple form that says like your name, your address in case we have follow-up questions, and then you can just type your question. But what I wanted to show you is here is the information for, sorry, I'm going to scroll. Is the recordings from the administrative bulletin for the rules presentations that we just did. So if you would like to see the administrative rules that we just put out that cover our eligibility and our access standards and those pieces, those are here. And that's my update. Does anyone have any questions that they would like to ask at this time?
Thank you so much, Kyra. And thanks for helping kind of explain how to navigate and the places to go because it is hard.
Yeah, I know that the website can be hard to navigate. So if you ever have any questions too, I can drop my email and my phone number in the chat and you can always just call and ask. Happy to help.
Thank you. Any other questions or comments for Kyra? Look how efficient we are today. Thank you so much, Kyra. All right, I'm going to turn it over to the lovely Leanne Moskowitz if she's ready. And
I think I'm ready. Let me see if I can grab and share here. Looks about right. All right, can y'all see my screen?
It's coming up, Leanne. Yep, there it is.
I'm going to try to keep it brief today so we can answer any questions folks have. So I'm just going to give a brief little update, and thanks to Lynn and Kara for bringing forward some of the information today. So I'm just going to give a little high level update on our initiatives that we have going on. Our Hope and Opportunity in Many Environments, which is our home initiative, our Responsive and Excellent Care for Healthy Youth initiative, our REACH project, and then the Behavioral Health Service System. I'll be real brief since Kara showed you the webpage. So, and then I want to talk briefly about supported employment services and how we can increase services through the delivery of telehealth. So with that, just remind folks that our home project is Hope and Opportunity in Many Environments. It's a project that we're working on to improve and ensure that everyone has access to high quality behavioral health, disability, and aging services in their communities. You've already heard about some of the changes that are going on with the systems alignment within HHS, how we're trying to align the behavioral health systems as well as the aging and disability service systems. So with the home project, our goal is to align our program design to meet Iowans' needs. So we're going to restructure the waivers to simplify the options, provide a broader service array, better address the needs of all age groups and disability types, which would include children, older adults, and Iowans with autism or developmental disabilities. Supporting for transitioning from our diagnostic-based waivers to needs-based waiver structure based on age. And then we'll address provider capacity also alongside the waiver changes to ensure that folks can access needed waiver services. So there's a lot of work going on in the background with the home project. So just to remind folks, we're going to take our current 6 diagnostic-based waivers and consolidate those into 2 age-based waivers. So it'll be a adult with disabilities waiver, age 21 and older, and then the child and youth waiver, which would be age 21 and under. And then we'll maintain the current elderly waiver that serves individuals 65 and over for folks who are aging but don't otherwise have a disability. And so in the future state with the child and youth waiver, one of the exciting things that I find is that these kiddos are going to gain access to employment supports and services. They're going to gain access to residential services that they don't have access to today, perhaps. I'll remind you, the only individuals that have access to employment or residential services today are individuals on the intellectual disability waiver, brain injury waiver, and our state plan HCBS habilitation program. So we're really excited to look at this menu and think about the possibilities for folks as we move into the future. We also have the adult and aging waiver. Again, folks who don't have access to employment services and supports will gain access to employment services and supports under the consolidated adult and aging waiver. And so we've done a lot of changes so far with the home project. Things that have changed already is we've implemented case management ratios. And so folks should be having better experiences with their case manager, finding that perhaps it's easier to reach and the responsiveness of those case managers. We also implemented case management certification and recertification requirements so that all of the case managers throughout the state, regardless of whether they are supporting MCO enrollees or whether they're supporting fee-for-service participants, will have a base foundational knowledge and education about supporting people within the waiver programs and our habilitation program. Also, we implemented the waiver priority needs assessment. So now anyone who is on a waiver wait list that has a urgent or emergent need for waiver services may request prioritization on the wait list. What that does is if we find that you have urgent or emergent needs, your name can be moved up the wait list. The other thing that I forgot to add here is that we did implement in lieu of services July 1st. And so in lieu of services are services that are available to managed care enrollees who are on one of our HCBS waiver wait lists to prevent either acute level of care, so prevent hospitalization or prevent institutionalization while you're waiting for waiver services. And so it's to keep people in their home with those essential services that aren't otherwise available through the waivers while they wait for their waiver funding slot to become available. And so there is, we did do an in lieu of service presentation in our town hall last August, if you want more information about that, or I'll be happy to send Amy the information. But it does include supported employment. So we know that when people are employed, they're healthier, right? They tend to remain in their homes longer. And so supported employment would be one of those in lieu of services that someone could request while they're waiting for a waiver funding slot to become available. We also have made changes in making training more available, more readily available for folks by the development of the learning management system. We launched that in April of last year. We have been adding content monthly to the learning management system. We are in the process of developing modules around employment that will also be embedded within our learning management system. And so this is free, available for anyone throughout Iowa to use. It's for caregivers, direct support professionals, providers, case managers, all audiences. I think there's something there for everyone. Also consumer choices option improvements. So we've been working on improvements to how services that folks choose to self-direct are identified and authorized. We've also been in the process of developing more oversight processes for our CCO program to ensure that folks are getting high quality services and that we're not engaging in any waste or abuse with those services. So we're really starting to turn our attention to those services. We did adopt the Inter-I ID for ID waiver eligibility and service planning January 1st. That replaces the supports intensity scale for ID waiver eligibility and service planning. Again, in the new home, we will have across the board both the adult with disability waiver and the child and youth waivers will be using Inter-I suite of tools to determine level of care and to also identify a level of need score, which will drive the individual budgets under the new waiver designs. And then, of course, we did transition the ID waiver assessments to our core standardized assessment vendor January 1st. And so we want all of our assessments to be completed by independent assessors who aren't tied to the funding decisions related to people services and supports. So the ID waiver was the first to transition. That started January 1st. We will be phasing in the transition of the other waivers to our core standardized assessment vendor in March, April, and May, so that by the end of June, all of the core standardized assessments are completed by an independent assessor. The MCOs will no longer have a role in completing those assessments. We felt that was important. We heard that people felt that was important, that folks be assessed independently. So that is one of the changes that has already been adopted. And lots more coming down the pipe. So the work has not stopped on the home project. So Iowa Reach is another project that we're engaged in right now. It's a new initiative focused on developing and improving and strengthening intensive home-based behavioral health services for children and adolescents with serious emotional disturbance in Iowa. And this is in direct response to the class action lawsuit related to not making accessible those intensive behavioral health services for children with serious emotional disturbance. And so the REACH will serve Medicaid eligible children across Iowa under the age of 21 who've been determined by a licensed practitioner of the healing arts as having a serious emotional disturbance that's not attributable to an intellectual or developmental disability. So the kiddo will not have an ID or a DD diagnosis as their primary, could be co-occurring, but their primary would be that serious emotional disturbance. So a mental health diagnosis coupled with functional limitations in day-to-day life, whether it be school impact, home impact, learning, living, etc. And there'll also be an assessment that's intensive, that intensive home-based services are needed to correct or ameliorate their condition. So to help the child improve in their goals related to their mental health. And so the implementation plan, there's an implementation plan published out there on the website. The implementation plan will be the approach to improve the delivery of those intensive home and community-based mental health services. That is published out online. I'll give you the link to the webpage here in a second. The goals, though, is to improve and strengthen the relevant services for the defined class, children with serious emotional disturbance, to meet their needs and maximize their strengths in order to live independently as possible, or in the least restrictive setting. We want kids to be at home with their families instead of in our institutions and our hospitals and our emergency rooms, and out of state facilities, right? We got a lot of kiddos out of state because we don't have the capacity in state. Develop a quality management and accountability structure that ensures ongoing quality assurance systems improvement for kids with serious emotional disturbance. So home and reach. So our pathway to improvement, we want to pave a new path to integrated services for Iowans, right? So our goal from 2022 to 2024 really was to learn about what the state of the state is, learn how we can better coordinate our systems, and help Iowans get better access to services. And so in 2025, folks, in 2024, folks have already started seeing improvements. And in 2025, additional improvements will happen. And so we'll have easier access to information through those aging and disability resource centers that you hear Kara talk about. We have Iowans with behavioral health needs will have access to the certified community behavioral health clinics that will be stood up this year. They're in the process of storming, forming, and norming right now. And then other services that we're in the process of looking at to help people who currently live in institutions come out. We're looking at those essential communication pathways and how do we build the processes and procedures to make sure that individuals have the ideal journey when they're engaged with Medicaid and HHS for their support needs. And so in 2026, we will be streamlining. We propose to streamline our services, so consolidating those waivers from 7 down to 3. So we'll have the aging adults with disability waiver, child and youth waiver, and our elderly waivers. We also want to improve our waiver waitlist system, so streamlining how that waitlist works, how folks are reviewed in terms of prioritization for the waitlist, and then of course strengthening our services, adding additional crisis services for those kids with SED. Right now, our crisis response system is really focused on adults, and so over the next years to come, we want to really start to build out those systems for children and those supports for children and their families. And so in 2027 and beyond, our vision is that children with SED will be able to access the services that they need, including new services that are under development, as well as receive the intensive case management supports that they need to so that they and their families are supported to remain successfully in the communities. And then, of course, we're going to look at adding the peer mentoring and community transition supports under the new home waivers in order to provide that additional support to individuals receiving those waiver services. So that's kind of our timeline and our trajectory. And so what we're envisioning is probably later this year going out for public comment with those two waivers, the child and youth and the adults with disability waivers for review and additional input. And so I think we already talked a little bit about the behavioral health system, but again, it's to improve the behavioral health outcomes for all Iowans, ensure equitable access to the full behavioral health continuum of prevention, treatment, recovery, and crisis services. Again, we want an integrated system, and we don't want to be siloed based on who's the funder is or what type of behavioral health service it is. And so the plan will be to combine the work and funding for mental health and addictive disorders into the behavioral health service system, transfer the management of those disability services from our local MHDS regions to the Division of Aging and Disability Services. And so it'll, be that supportive, connective care for Iowans and their families with disabilities so that we can really help build out the ADRC network for the creation of a disability service system. So disability service system will step forward, right? We're going to put the D in ADRC going forward. So, and I think also strengthening those important connections between Medicaid, public health, child protective services, gathering feedback from our Iowans to help inform our system planning going forward. So there's a lot of ways for folks to gain input. You've already seen that there's behavioral health town halls coming up. So here's your the links and the dates and times. Go visit the website here. So also provide your feedback. We have Medicaid town halls. There's a members only town hall and a provider only town hall once a month. We try to, part of it is information sharing and the other part is feedback giving. We want to hear from the public. We want to hear from providers. We want to hear from Medicaid participants. And this is the opportunity to be heard and to have your voice contribute to the changes that we are making as a department. And so come to those town halls and share your feedback. We're seeking input on the home project continuously. We update the web page as the steering committees occur, as there's new developments within the home trajectory. We keep that information updated. The REACH project, you want to learn more about that. You want to get engaged in that. The presentation materials are out there on the REACH homepage, and then the behavioral health system homepage that was shared with you before. So supported employment services via telehealth. Supported employment services may be delivered via telehealth when the member chooses to receive their services via telehealth and that service modality is clinically appropriate to the person's needs. So telehealth means the delivery of supported employment services using real-time interactive audio and video or other real-time interactive electronic media, regardless of where the healthcare professional, regardless of where your job coach or your supported employment professional is at the time, and where the covered person is located. It does not include services delivered solely through the telephone. We can't just make a phone call. It has to be that face-to-face, real-time interaction between the service recipient and the service provider. So, when services are delivered via telehealth, the case manager and the supported employment service provider assesses the member's ability to be supported via telehealth. Is this safe? Can the member, are they able to receive instruction via audio video chat, are they able to be supported in their employment goals through that modality? And then they meet with the member's employer to discuss the support provided via telehealth if the member's currently employed, right? This is what we'd like to do. This is how we'd like to do it. Does that fit? Does the employer have any concerns? And then, negotiate what that will look like while the person's on the job. The case manager must document in that person-centered service plan how telehealth will be used to deliver the individual supported employment or long-term job coaching, whichever is applicable. And the provider documents the service delivered via telehealth just like they would the in-person supports. And the documentation must support the claims bill. So providers for the SE delivered via telehealth, for your claims, you'll add O2 as the place of service. So instead of where the person is employed as the place of service on the claim, it's telehealth is the place of service on the claim. Same billing procedure codes, right? Your H2025s, your T2018 UC code, same codes. You're going to add O2 on that claim as your place of service. And here is the informational letter that gives you more guidance about billing Medicaid for telehealth. If you have questions, one more thing. I would be amiss if I did not introduce Mindy Williams. Mindy Williams is going to be coming our supported employment or our employment services subject matter expert with Medicaid. I'm not going anywhere. I'm still going to be here supporting Mindy. But as Mindy gets more comfortable, more familiar with all the hard work that we've all done over the years, I'll step back and she'll step forward. So Mindy, you want to say hi and maybe introduce yourself briefly? Give the elevator speech about who you are, where you come from, what your passions are.
Hi, I'm Mindy Williams, and I'm with LTSS Policy. And like Leanne said, I work with habilitation services and child mental health waiver currently, and now I'm moving into employment policy as well. My background is I was a case manager for about 17 years, so I do have quite an extensive knowledge in the case management world. But yes, I'm excited to start attending these meetings and learn more.
Thanks, Mindy. So if you have questions, feel free to reach out. I always love to share my colleagues' contact information in case she's not, offering that up so quickly. But reach out to any of us. We'll be happy to answer your questions. If we don't know the answers, we'll point you in the right direction. All right, I'll stop sharing.
Leanne, we had a question. Will there be any changes with HIP?
Will there be any changes with the HIP program? I am not aware of any changes with the HIP program now. That is not part of the home conversation. And so I'm not aware of any changes or any legislation that's in process right now that will change the HIP program.
Roxanne, did you have anything else you wanted to ask her about, or did that cover it?
That covered it for that. I guess the only other question, Leanne, is, there's a lot of letters going out to families here in February, and they're very confusing because they mention like a start date for the waiver, the HCBS waiver last year, but it references SSI and eligibility for another year. And anyway, it's just very confusing to a lot of families right now. And I don't know if you're aware of those letters that are going out.
These are letters that are coming out from HHS or the MCO?
Neither. Ours for our daughter who's on the brain injury waiver and she's on SSI and SSDI. She's 21. It came from Council Bluffs, Medicaid. it's
So
a notice
Council
of
Bluffs
act.
is a centralized facility unit. Is this the continuation of
Yes,
eligibility?
yes.
Okay.
But it references the application for brain injury waiver approved last year. And I guess they're getting a ton of calls on it because in the gal I talked to this morning to follow up regarding our letter, and I've talked with several other families across the state. It's just very confusing the way the language is worded, and they're trying to get it changed.
Okay.
It really doesn't have anything to do with the waiver, but
Okay.
it's on there with the wrong start date last year. I mean, anyway, I just wanted to make you aware of it.
Thank you. I will reach out to my eligibility colleagues in the centralized unit, make sure they're aware of that and see what's going on with that. Thank you for bringing that up.
Yeah.
Thank you, Roxanne. Thank you, Leanne. Thank you, Leanne. Thank you, Mindy. Any other questions or comments for Leanne or Mindy? I have a quick question for you, Leanne. We have some really good partners who are here today who support youth in transition. And so a question I have is, when you talk about REACH, for example, what is the best way for those that support youth with disabilities who are preparing for transition or currently in school who might have a need? What's the best way for them to find out information and process and keep up on things so they can be a good resource to families?
Yeah, so I think if they are looking at what's available through HHS, Iowa Medicaid, we've been working really hard on trying to improve our content out there for participants and for members. And so I think, the AEAs are a great resource. They're a great partner. So I think reach out to your AEAs, right? Because they are the resource for what's available to kiddos, those school-based kiddos. And I think also, you're coming to the HHS web pages. We update that information all the time, the HCBS webpage specifically. If folks are wanting to know how to apply for the waiver, we have all kinds of training content out there in the learning management system. There's an HCBS 101. That HCBS 101 will tell you how to apply. We'll show you the roadmap on what that looks like. We also have that available out on the HHS HCBS webpage as well. So I think there's just a lot of good information out there. I think our other state entities also have information about accessing Medicaid. So I think go with your AEA or maybe come straight to the HCBS web pages, and if you got questions, reach out.
Thank you. And for our AEA partners who are here today too, if there's things that there's areas that you see a need, and there's gaps, or you're wondering how to access some of those things, I think it would be great to let us know. You can let Leanne or Mindy know. You can let Kelsey know. We really want to just ensure that people have the right information and can kind of understand all these moving pieces. Thank you. Any other questions or comments for Leanne? As always, Leanne, thank you, thank you. A lot of good information. And if you could share your presentation, I will put a link in the chat for folks. Thank you. All right, Rebecca, I'm going to turn it over to you for an Iowa Department for the Blind update.
Awesome. Thank you. So much excellent information today. I love these meetings and just getting to hear about all the changes and the things we're doing together. So Mine will be pretty brief, but the Department for the Blind has been operating for 100 years now. So we are having a centennial celebration. So we were established in 1925, and we are going to have an open house. I'm going to share my flyer. Well, actually, I might just email it to you, Amy, the PDF. So I have a flyer for that. The information that we are doing an open house. So we are opening up the department for the public. We will have the governor there, and mark your calendar for Wednesday, April 2nd. We're planning to do tours kind of on the hour. We're going to have hors d'oeuvres. We're going to have swag. We're going to have a lot of things. We want the community to come in and visit and kind of see what we do for the department. Our kind of motto moving forward is making strides moving forward. And so we'll have some fun promotional items available as well if you would like to support the department. So we've had a lot of changes. Like many of the agencies we're hearing from today, been restructuring some of our programs. So we're going to be really excited to share out our kind of new model, added policies, how we're working together with the community to just provide, those services to individuals who are blind in Iowa. So really big. It's going to be exciting. I hope to see everyone there. In April also, we're kicking off our new supported employment training with Iowa Department for the Blind. So I have another save the date I'm going to send to Amy to share with the team. We have been working very closely with QE Technical Assistance for Quality Employment and VCU, and we're partnering with them to help. Once we restructured our supported employment policy, and now we're doing trainings on roles, responsibilities, how we engage with our community providers. So it's going to be a dual training we're going to offer to both counselors with Iowa Department for the Blind and community providers that would like to work with our agency. And with VCU, we're going to attempt to make them worth CEUs. So this will be an exciting training that you can attend and get CEUs. It will be, we're trying to do maybe a hybrid virtual option and in-person option, because I know not everybody's housed in the Des Moines area. So more to come on both of those events, but these are our fun save the dates, and we're just looking forward to providing another 100-year of services. Any questions about our events going on?
That's pretty exciting. And I like that you mentioned there's swag and snacks.
Well,
that should bring the masses in.
You can't have a party without swag and hors d'oeuvres, so it's a celebration.
Thank you so much, Rebecca. Any questions or comments for Rebecca? Thank you. And we'll share that out as we get it with everybody. I'm going to open it up now to any other partners who might have updates. Often we have somebody maybe from ICIE. I don't know if we still have anybody on from ICIE who might want to do an update. Just give a second and see. All right. Any other partner updates, things folks want to share? All right. Well, we're going through some changes with ICIE, as we are in our entire world right now. Our departments and our country. It's a lot of moving parts. And we're still trying to figure out sort of what things are going to look like as we move forward with ICIE and ICIE's work. And so our core team decided at our last meeting that for our May 15th meeting, it will be a virtual meeting again. Typically we meet in person, but we're trying to make it doable and accessible for as many people right now. The hope would be to still maybe have an in-person event, but we're still trying to sort out what that might look like. So right now, the May 15th meeting will be virtual. I'll share with folks a link. The dates that we typically have for ICIE meetings are August 21st and November 20th. We're still determining sort of what that might look like. And so we'll keep you posted on that. I want to thank the DRI WIPA folks. If they did a couple of ICIE's community of practice sessions on benefits planning, both for adults and one session focused on transition age youth. And so at this time, we're still determining what our March community practice will be, or if we'll have one in March. So we'll keep people posted on that. So any other, oh, Misty, I see that you're there. Thank you. Watch for Iowa APSE's 2025 COPs to be coming soon. We're happy to share that out with our mailing list as APSE has that available. And then thank you, Brooke, and everybody for sharing resources and information, encouraging advocacy. It's a good time. It's a good time to say what you want. Anything else that folks might have at this point? Look at us, we're done early. I don't think that's ever happened. All right, well, thank you, everybody. Thanks to all our presenters today, for everybody for attending. Stay warm, have a great week, and we'll be in touch soon. Thank you.